Hello, everyone. Hello. Welcome to Phoebe's Place. I am back after a year hiatus. So, welcome all those who are joining. Welcome, welcome, welcome. And listen, we are in for a treat. I am so excited to hear about this conversation, and I'm so excited to hear what my guest has to say to help us out. So, listen. Let's welcome Tashiana Elise. Yay!
Yay!
Okay, so listen. So let me say this. I want to thank God for today. I want to thank God for my
Yes.
support, which is my husband and Jorge and Maya. It's been a journey coming back here, but I'm so glad we made it. So today we're going to talk about being a doula. And this is derived, I
Yes.
took a look at this last year, and it's called maternal mortable, she gonna help me with that word, okay? But she gonna help me with that word. But we're talking about our African American women who are being pregnant, who are not getting the care that they're needed, they're due, and they're experiencing racism. And listen, we have an advocate. So my guest is an advocate, Miss Tashiana Elise.
Absolutely.
Introduce yourself to the world.
Hi, everybody. My name is Tashiana, Tashi for short, and I am a doula here in Southern California. I serve in pretty much any area that is needed. I can serve in desert area as well. And I've been a
Awesome,
doula
awesome.
for about 3 years now.
Awesome. And Tashiana, tell us what the purpose is for a doula. What is the purpose of a doula for our women who are pregnant?
Well, a little fun fact: the word doula, roughly translated in the Greek, means slave. But a doula essentially is a person that is a birthing coach. Doulas coach women who are giving birth, and it even starts before that. Doulas help with breathing techniques. We help easing the pain. We also are a voice for our clients that feel they're not getting the proper medical attention that they feel that they deserve. A doula also helps. It's beginning to expand now because we have postpartum doulas, we have full spectrum doulas who are with you for the prenatal, labor and delivery, and postpartum doulas as well, who help you, settle in when you get home, when you have your newborn. Some help with light cooking, helping you to breastfeed, to get started on that. So, in any area childbirth from start to postpartum, that's what a doula does.
Oh wow. And I see doulas as advocates. So explain to us now, a doula does not take the place of a doctor, but the doula is an advocate for the
Oh,
patient.
no, no, no.
Mhm. So explain to
Yes.
us how that works.
So, well, a lot of times how that works is, first, let me start by saying for people who don't know, 50% of doctors still feel that African American women or African Americans in general don't feel pain. And that
Mm,
stems all the way back going to slavery days. So,
okay.
but moving forward, there are certain complications that some women have during the laboring process, and sometimes the nursing staff or the doctors, they don't really take the pain of their patient seriously. So a
Mm,
doula essentially makes sure that the doctors and the nurses are held accountable for things, like accountable for pains that they need to investigate, and hold them accountable for making sure that the patient, while they're in labor, is being heard for any of their aches and pains. when you do this work, you hear nurses and doctors tell their patients a lot of times, "Oh, that's normal," or "Oh, you're supposed to feel this way." But we live in
Hmm.
our bodies, we are the captain of how we feel. People
Mm.
can't live outside of your body. People that live outside your body don't know what's going on internally. So as
Yeah.
doulas, we help, we're that extra voice that alerts the doctors and the nurses to dig deeper with the pain, because there's always something there that either they're not taking seriously or something serious that needs to be investigated further, and it could save the mother and the child's life.
Yes. Yes. And that's what's been going on. And I don't think we realize that. This has been
Mhm.
going on for quite some time. A lot of our African
Yes.
American, and I keep saying that because we don't understand that a lot of our Black women are passing away. They're dying for the lack of care. It's go on YouTube, it's all over the place. And we need an advocate. And I say we as women, as Black women, those that are pregnant, those that are looking to get pregnant, educate us on the process of getting a doula.
Well, it's very simple. A lot of doulas are found out by word of mouth. I'm actually a part of a collective here in California called the Sankofa Birth Workers Collective. It's a network of doulas, as I said before, midwives, lactation consultants, and mental health professionals that help
Mm,
Black women through the whole state of their pregnancy. So to start, doulas usually come in at about 34 weeks. You start out with a prenatal. You kind of ask the mother, like, what is it that they want? What is it that they're looking for? Especially if they're a first time mother, you're there to essentially ask questions. Doulas can suggest breathing techniques,
mm,
essential oils that can be used during the birthing process, breathing techniques, exercise balls. There's a peanut shaped ball that is also used in the delivering room, also pressure points that are
mm.
used during the laboring process. Uh, as well, because some women who don't want epidural, we don't really tell them what they can and cannot do with their bodies. If they would like an
Okay.
epidural, you go right ahead and do the epidural. If you want to tough it out, we're there to help as well. So
Wow.
doulas are just there to be the voice for the client. So we meet up
Okay.
with the mother and their support person, and we're there to ask questions all the way up to the delivery date and even through to postpartum when they go home from the hospital or birthing center.
Oh, wow. Wow. Okay. So listen, I have a question. I think I talked to you about it because you mentioned it yesterday. So if we can't get to a doula, so for you, if someone wanted
Yes.
you and your services, how can they get to you? And you also let me know you do virtual
Yes.
consultations as well.
I do virtual consultations. I'm available through email. I do virtual birth work. So even in labor, I can be reached on the phone, on an iPad to coach the mother through laboring, no matter how long it takes. I'm even can be there physically in person.
Okay. So you said that the mother should obtain a doula around 32 weeks,
Between 32 and 34 weeks.
between 32 or 34. Okay. And what are the things that a doula would look for? What are things that you would look for? Let's say, there's a young lady, she's
Mhm.
3 months pregnant, 4 months pregnant, and she wants to be ahead of the game and she's looking to seek getting a doula. I mean, is it so price wise? You don't have to give the exact, but price wise overall, is it very expensive for a mother to get that, a doula?
I'm very glad you asked that question. California has passed a new bill that where if you are Medi-Cal, because the hype is that doulas are only extended to the rich. That's what
Okay, yes.
the hype is. But
Mm-hmm.
in all honesty, The work of a doula has been around since even before slavery. So in
Okay.
Africa, the elders of whatever tribe you were from, they were the ones that you went to when you were pregnant. Even in slavery time, and even after post Civil War, the old mothers, they helped the mothers give birth to their babies. So
Wow.
this work has been around for a very, very long time, even till now. So yeah, doula work has been around for a long time. But going back to what I was saying, California has issued doula services through Medi-Cal. So if you are a Medi-Cal
Oh,
recipient, you can request a doula through your Medi-Cal insurance, and you get three prenatal visits. You also get a doula for your labor and delivery, and you get three postpartum visits with your doula as well.
really?
Yes.
Now that is wonderful to know. And so it is, you have killed the stigma of, oh, I can't afford a doula. It's just too expensive. And,
Yes.
you know,
Hmm.
you have killed that stigma. So
Yeah.
everyone, please listen and know the ones that are pregnant, you can get a doula. Now, okay, so that's for the
Absolutely.
Medi-Cal. So if you have it through the insurance, can they go through the insurance or can they privately pay you?
Insurance and private pay is also an option as well. You also don't have to pay like the way I do it for myself. It doesn't have to be in one sitting.
Hmm.
It can be done
Oh,
over the course of uh, the the course of when you have your client. So it doesn't have to be in one
wow.
sitting. If you have insurance, it can be extended through your insurance, through private insurance, or you can pay out of pocket. But I do always encourage, if especially if you have Medi-Cal, to take advantage of the services that they now have for mothers to have a doula, especially for mothers who don't have like a support system. I wholeheartedly suggest.
Wow. So if someone wanted to gift a mother to have a doula, and so we would contact you. I'm promoting you because right now I'm interviewing you, so I'm promoting you. So we would come to you if we want to gift a mother with your services. Now, question: what if they're in a different state? You're in
I
California.
can I can be reached in a different state as well. I can
Okay.
virtually. I'm gonna start extending my services towards Nevada, Vegas area, since I do live in Barstow. So that's an option as well, as well as other cities that are essentially connected. So such as Bakersfield, Fresno area, California City, and I even come to Army bases as well.
Really?
Yes.
Wow. Okay, so now we have no excuse. None, no excuse. And I really want to encourage. I read this and I want to read this really quick because it was astonishing for me to actually hear this, and this is reported. So the maternal mortality ratio
Hmm.
per 100,000 live births, the maternal mortality is, what is it? It says it's approximately 700 women, Black women,
Hmm.
die
Yep.
each year for pregnancy, the delivery complications, people just not being and not all medical doctors, I want to say that not all medical doctors are the same, but the racism
Right.
is out there for some practices. Is estimated 50% of the Black women this is happening to. Uh, that, that's half.
Yes.
That is half.
Yeah.
What have been your experiences or your testimonies that you've spoken with some of the women that were pregnant that they experienced during
Oh,
their
more.
pregnancy?
Uh, well, more or less the same. A lot of the mothers have told me. I have told my doctor about A, B, and C. They're telling me it's normal, or they're telling me like you're gonna hear a lot, especially as a Black woman, when you voice a concern, even from my own pregnancy experience, a doctor will tell you, "Oh, that's normal," or "It'll pass," or sad to say, unless it's like an emergency where you're like bleeding out, is really the only time you get any attention. And that's really sad because by that time it's
Wow.
already too late. And
Right.
I've even had doctors tell uh, mothers prematurely, "Oh, your child may be suffering from A, B, and C," and
Mm.
have the mothers kind of like worried in a sense, like they can tell their patient, "Oh, well, it looks like your child may have Down syndrome," and then
Yeah.
they unnecessarily worry the mothers because now they're like, "Oh, how am I gonna labor their child if this is happening? Like, what else do I need to know? This and
Hmm.
that." And I think it just puts unnecessary stress on the mother, and it also puts unnecessary stress on the baby as well because the baby is feeling that from the
Yes.
inside.
Mm.
So yeah, it's a lot of just disparaging remarks that come from the physicians, and we just have to, it's sad to say, we have to fight, you
Yes.
know for our voices to be heard. I tell clients all the time, if you don't like your primary care physician, ask for them to change it. Ask for them
Exactly.
to Women need to know they have complete autonomy over their bodies when it comes to
Say
giving
that.
birth.
Okay.
They don't have to ask the doctor, they don't have to ask anybody. You let them know, and you have to keep pushing, and also hold these physicians accountable. Let them know, put it in your record. Okay, I make sure that you put in that you did not understand my advances when I told you about A, B, and C. So
Yes.
it's up to the mothers and even as doulas to hold these healthcare professionals to a standard and to make them accountable for their actions.
Say that. That is very important. And also, and this is why there's a doula there to advocate for you, to let you know what you need to push and do. No, if you're experiencing this, this is what you need to tell your doctor, and action needs to be taken. And if that doctor is not doing what they're supposed to
Absolutely.
do, get another one. There are so many OBGYNs out
Absolutely.
here. Get another one
Yes.
that
Hmm.
will care about your situation, because I was also reading when they're delivering, sometimes the babies are passing away because the doctor did not detect the problem in their while they were carrying the baby.
Hmm.
Preeclampsia, that could have been addressed early on in
Oh.
the pregnancy.
Hmm.
Help us out.
Yes, because preeclampsia, it's still one of those things that still needs the research done. With
Okay.
preeclampsia, it really is something that is currently in development. There's constant research that goes on, especially for mothers that carry
Okay.
that have high blood pressure and things
Mm-hmm.
of that sort.
Mm-hmm.
So I always tell my clients, to, if something, like I always say, if something doesn't feel right, tell the doctor. That one doesn't listen, go to another doctor. You know how
Oh,
you feel within your own body, so you have to, even if it feels even just a little off. I tell my clients
yes.
all the time, even if you feel if it's a little off, ask questions because it can save your life and your baby's life. So,
It's the absolute truth.
yes, it can save your life.
And we got to take as women, we got to take responsibility to take action, to do what we know to do. And this is exactly why I wanted to talk about this and have this conversation, because I don't think a lot of people do. And I think that the mothers that are getting, you know, pregnant, feeling like they have to go on, walk this through by themselves. But I do like, and I will encourage those, if you know that the person that is the woman that is pregnant cannot afford it, well, gift them this opportunity to have a doula to assist them and walk them through even if you don't have enough to do the whole time, but like she said, you can make payments to walk them through this journey. So they won't feel like they're by themselves. Because sometimes, I don't know, it may have changed because I haven't had kids in years. But, when you're early on, you only see the doctor once a month.
Pretty much,
Um,
yes, yes,
and it gradually goes on as you get closer to your due date. So
yeah,
anything can happen
yes,
between that time that you're.
absolutely.
So tell us, Ms. Tashiana, what else are you doing? You are a doula, and what else are you doing in your life? Because
Well,
you're a mom. Let me say that. I'm
yes,
sorry. You are a mom. So
I'm a mama.
she understands.
Yes, I totally understand. And my son, he's 8 now, but he is so excited about me doing this work. Yeah, he's not a baby anymore. He's
Wow.
almost a preteen, but yeah, he fully understands the work that I do. And he even gets so excited about like the babies
Oh.
being born. So he loves seeing the pictures, and he knows that if I got to get up in the middle of the night, that he's always ready. If there's a birth, then he knows, oh, we gotta go. It's that time. So he gets excited too about the
Oh,
whole
that's
thing.
so nice. So see, you can even do it as a single mother. So if someone wants to
Oh,
become a doula, what is that? What can that individual do?
well, there's a website called Donna. That's Dona. And it's a basically a database where you can search anywhere in your area to go to training. I was trained through the Sankofa Birth Workers Collective out of Riverside, and I got to do my training for free. They also did
Mm,
a training in the high desert area, and they have even a training in the deeper, almost California borderline. I believe Blythe. I believe. I hope I said that right.
okay.
But they're also doing training there as well. They have training courses anywhere to
Okay.
be a doula, and it doesn't require a whole lot of education as well. I mean, if you've ever supported anybody that has been in labor, congratulations, you're a doula and you don't even know it. So it doesn't require, like I
That's
said, a
nice to know.
whole lot of it doesn't require a whole lot of education. Although I will say there are a lot of educated women who have taken on being a doula. There are therapists who are doulas, RNs who are doulas as
Wow.
well. So
Okay.
if you are already in the medical field, you can tie that onto your license as well.
Oh, wow. That is really, really nice to know. So we're almost finished. So Tatiana, what else are you doing besides being a doula?
Well,
Because
I have
I've been watching you.
decided
You've been acting.
that too. Yes, yes, I have gone on to acting, and my ultimate goal is to become a lactation consultant, to add lactation consultant onto my license of a doula as well, because I get so excited in postpartum when I'm able to help mothers with the breastfeeding process of with their children. It's just such an intimate, and it's such a beautiful thing to see. And it's like a bonding that helps create with the mother and the child. So I'm going into lactation consultant as well. So hopefully
Okay.
I'll be done with that next year.
Okay. So see, next year you can have her after you have the baby. And that is something important because, well, I was one where I just I didn't see a need, but doing studies over the years, just watching, that is a very intimate place for a mother to be able to breastfeed her child. And that's a
Yes.
very close relationship and a bond that they would have. So I'm glad that you're going into that area and into that field. Do you think being a doula, is there another level of being a doula, or it's just a flat position of I'm just going to be a doula and that's it? Is there anywhere where you can, hey, I can have my own, center of doulas that I can disperse? Well, oh,
Well, there are doulas who are a collective, like the one I am a part of. Some
okay.
doulas, there's some doulas that I know that are moving on to becoming midwives and hope
Mm,
to open a birthing center very soon as well. So it doesn't have to stop at being a doula. There's something called hypnobirthing. There's also spinning babies for mothers whose babies are breached. You
oh
can get
wow.
certified for that as well. Some mothers also um, are resources in the community. So they go to community centers and they help
Okay.
mothers with like diaper distributions. They help mothers get food when they need food, clothes when they need clothes, help them with formulas. So there's a
Wow.
community uh, doula as well that goes out in the community and they help educate also. Um, in their communities. But yeah, it doesn't have to stop there. Like I said, doula is a universal term. You have
I
your
see.
doulas who do so many other things.
Wow. So it's a huge opportunity. I have a personal question. What's the difference in a midwife and a doula?
Well, from what I was taught in my training, doula is up here with the mind, and midwife is down everything else below.
Okay. Okay.
Yes, doulas
Okay.
that we don't catch babies, we don't do medical exams, we don't diagnose, we don't give medications. We are just there to coach and support the mothers from prenatal to labor and delivery and postpartum.
Wow. That is an
Even
awesome
though I have
list.
caught a baby before,
Really?
not on purpose, but or not, but I have caught one before.
Oh wow, this was very educational for me. Um, but I really appreciate you coming on. It's been a year. We've been talking about this for a year.
Oh yes.
And so listen, if you want to see it, jump on my YouTube at Phoebe Wells. That's the spelling of my name. I got to figure out why it didn't come on my Facebook page, but that's okay. It's on YouTube. So I'm going to share that once we get done. But I just want to thank you so much for your education. I want to thank you for being there for our mothers. I am going to be reaching out to you. I have a certain mother that I'm looking at. She may need some,
Hmm.
advocating. And I'm
Absolutely.
glad that you said that it's for doulas are up here for the mental part of it all and to
Yes.
add support. So, So I'll be checking with you right after. But thank you so much, Tashiana. At least, is there anything you want to say before we close out?
Uh, no, but thank you for having us. The doulas, we're out here and we're ready to serve. And we just want to be there for mother and baby and families. So if you need a doula, I highly, highly encourage you to please get a doula.
Yes. Caller or caller. There you go. Call her. Um, because I know that she really cares. And you don't have to worry about her. How does she know? Well, she has a son. So she knows she's walked through the journey. Experience is better. And I love when a mother can get with a mother and just really walk her through that journey of pregnancy. Outside of that, I thank you so much. Listen, I will be having a show every fourth Thursday of the month. My next show will be next month on the last Thursday of July. Outside of that, thank you guys for joining in. Thank you, Tashiana, Elise. Stay there.
Thank you
I'm going
so
to get off, but
much.
stay there. Don't you go nowhere. But you guys have a
All right.
wonderful evening. Bye bye.